Welcome back to Hot Flashes and Cool Topics podcast. Today we are going to be talking about peptide therapy with Dr. Suzanne Ferree. She just launched a new book called Counterclock-Wise, Using Peptides to Renew, Rejuvenate, and Rediscover. Welcome to the show.
Thank you guys so much for having me. I appreciate you.
It's an interesting, well, we're glad you're here. It's an interesting conversation about peptide therapy because I'll admit I didn't know very much about it before I, took some time and read your book. And I guess my first question is, what are peptides? A lot of people don't even know what they are.
So you're not alone. There are actually, most doctors probably don't know what they are either. This is kind of a niche specialty to learn about peptides. But the cool thing is peptides have been studied since the 1920s. They are part of your body. It's what your body naturally makes. So the most famous one is probably insulin, but there are lots of others that are really famous ones that we figured out how to make. So what happened was someone figured out what these little pieces of strings of amino acids do. So if you think about a chicken breast and the protein that's in a chicken breast, that gets broken down into smaller and smaller pieces in your body. The very tiniest piece is called an amino acid. But if we put 50 of those amino acids together, so that's a slightly bigger chunk, then we call those peptides. And then a protein is anything over 150 amino acids long. So this is, it's just a small fragment of a protein. These are naturally made by your body. And like I said, insulin, but there are several others that are familiar to you probably. Things like the blood pressure medicine, losartan, and the topical antimicrobial called bacitracin. If you've ever used that, like on a cut or a burn, bacitracin is also a peptide. So they've been around for years and years. And most people are familiar with the very, very famous one right now called Ozempic or semaglutide. That's been slightly modified from the natural version to make it stay around for a week. So it just have to do an injection once a week. But that's the other famous one that's out there right now.
Yeah, you talked about injections, and in the book you talk about the different ways that you can receive peptides, injections, transdermal. Can you talk a little bit about the different options?
Absolutely. So most of them are available by injectable. The nice thing about the injectables is we know that it's getting into your system. It's not getting digested or broken down in your stomach. Like I mentioned before, these proteins or peptides get broken down into smaller and smaller fragments so that they're digestible or absorbable by your intestines. So we don't want them to go through that way if we don't have to. Now, there are a few that are naturally made in the stomach. So there's one specifically called BPC 157 that is made by the stomach. So it is designed to sustain the low pH or acidic environment of the stomach. And it's interesting because that one is involved in helping to protect the stomach against ulcerations. If we use it in other places, so if we give it by injection or if we give it orally even, it can be really helpful in tendinitis or in joint pains, in other inflammatory states. So it's a very general anti-inflammatory, but when taken by mouth, it can help to prevent stomach ulcers or to treat stomach ulcers.
I wanted to start at the beginning with what is peptide therapy? How did it come? Like your book is very comprehensive in different areas, like how it helps sleep, how it helps with athletes. But what is peptide therapy and how would someone even know to ask for it?
Sure. So these are just things we know that can be helpful that are available, and they work specifically at the cellular level. So what peptides do is they're sort of like the construction manager or the general contractor of your construction project. They go in and tell the cells what to do, and then your immune system takes over its part. Your intestines take over their part. Everybody takes over their part once the construction manager comes in and says, okay, here's the plan. Now we need the plumbers and the electricians and the framers to do all of their jobs to build the house. It started out being very popular in the bodybuilding community. That's where most of it started to be popularized. And then it became easier and easier to use and to make in a lab. So now we can get access to many of them. A lot of times these are used in what we call stacks. So this is 3 or 4 different peptides that are used together. They all work synergistically, meaning each one contributes to the overall effect of the others. And together they do better than individually they would do by themselves. So a lot of people will use just one, but in a lot of cases, especially in patients who have more significant illness like MS or Lyme disease, we'll use a combination of these to get at different parts of the immune system or different parts of the body's repair mechanisms to help them to recover from whatever illness or injury they may have sustained.
So if someone was suffering from fatigue or some other issue and they went in, is this something the doctor has to do a blood test for and then send it to compound therapy? Like, how do you create these peptides out of the body?
Yes. Yeah, so they are created in a lab. They're mostly synthetic right now, so they're not from an animal source. In case somebody's vegetarian or vegan, they're not from an animal source. They are synthetic, created in a lab, but they have the same amino acid sequence as what your body would naturally make, unless they are specifically modified to make them last a little bit longer. So let's say you come into the office and you have fatigue. Hopefully your doctor will do quite a bit of searching and asking about why that fatigue may be present. There's lots of reasons why it might be present. Fatigue is such a general, big overview symptom that can be caused by so many things. But if sleep or poor sleep is one of your problems, then we're going to look at what you might need as far as a peptide. And there might be a lot of other things that we would do. Peptides are sort of like the icing on the cake for what we do. So we would make sure that your lifestyle is normal, that you're doing good sleep hygiene, that you're managing your stress well, that you are taking care of your sleep environment, like there's no pets in your bed that might be waking you up or snoring bed partners that might be bothering you. So all those things need to be in place. Peptides aren't going to fix a snoring partner. And so, but they may help. You know, there are some peptides that are specific for helping you with getting that deep sleep and improving your REM sleep. There are several that are available for helping with sleep if sleep is the problem. Again, fatigue can be due to many things. It can be due to thyroid disease, and then a peptide isn't necessarily going to be helpful. You want to fix the thyroid. So we want to make sure that your doctor does all of those things first. And then if those things are not responding, or if there's none of those present, then we would go on to consider doing a peptide or a peptide stack whichever might be appropriate for you. There are probably 500, 800 doctors in the United States that are certified in peptide therapy that know how to prescribe and administer these medications. And they do come from a compounding pharmacy. So they would need to be prescribed by your doctor who is a specialist and through a compounding pharmacy.
Right. And in your book at the end, you have how to reach your place too, which is Vine Medical Associates. However, you did put a different thing in there where people could try to find it, because 800 throughout the United States. But this sounds really fascinating. And Colleen had stated earlier, there's so many things that peptides can help with, which I was reading it and thinking, our target audience is a midlife woman. And there were so many things in there, things that have to do with menopause. I mean, inflammation, sleep, like you just talked about, hormonal issues. Did you notice what was the difference you noticed when you treated midlife women? If you started treating them with different peptides, what was the result with that? And what have you found to be helpful?
So I am my own avatar. When people ask me, who is your book written for? And I say, it's written for me. It's exactly what I'm looking for. I came to this journey with an injury of my own and had was just approaching menopause. And of course, I'm sure you've heard this before. You all have talked about this on your show, where menopause really begins around the age of 40. So you need to begin looking really early for when that starts and begin treating really early, because the earlier we get your body used to being on hormones, the better it responds. If we wait until we're 60 or 70 before we start treating, it's a little bit more tricky and a little bit more complicated. So starting as early as possible is ideal. The things that we'll see is women will be able to lose, they'll change their body composition. So they'll be able to lose fat and gain muscle mass, which is one of the things we have trouble with in midlife is gaining weight around the middle and then losing our muscle mass. And of course, you can't gain muscle mass without exercising. So I'm going to also encourage that you are in the gym doing some weight training, doing a bar class, working with a trainer. I'm a huge fan of working with trainers, because I think that we all need to have that, not only the accountability, but also the the guidance on so that we protect ourselves and don't injure ourselves. Over the age of 40, we're at greater risk of injury. And so this is also one of the things that peptides can be helpful for, is both preventing injury, strengthening our tendons, strengthening our muscles, but also in recovery from an injury. So this is really where they shine. And when we talk about using these in the bodybuilding community, of course, the bodybuilding community is using, super physiologic, way higher than needed doses for their purposes. But for us who are just trying to every day continue functioning the way we've been and keep our, sort of optimize our existence, they're really helpful for things like sleep, for things like optimizing body composition, improving fat mass, improving muscle mass. So you're not going to really see a weight loss per se, although there are peptides that are specifically for weight loss. But what you may see is a change in body composition. So your body is healthier in general because of that. We know that as we age, growth hormone is depleted, and a low growth hormone in an older person increases the risk of death from all causes. So we can give you a growth hormone secretagogue, which is a peptide that mimics the natural peptide in your brain that causes you to secrete growth hormone. So we would give you that peptide. It's typically available by injection. Then your body will make its own growth hormone and make it in larger amounts than it would without the growth hormone secretagogues. So now we'll see that your body begins to create energy better. All of the cells of your body are way more efficient in how they create and use energy. And so that's how we get this great change in body composition and the ability to recover. So this is where we see the most benefit is in this recovery. So I'm sure you've noticed your 20-year-old daughter or son can go and not exercise at all, and they can go run a marathon, and then they get better. 2 days later, they're back to their normal functioning. Whereas you or I would be, right, as we go. And so these help us get back into that lower age recovery process where we're able to go and do more things and not have that 3 or 4 or 5 or longer days of recovery post-workout.
In your practice, when you do see midlife women, like Bridget was saying, what are some of the conditions that peptides work best for?
Mm-hmm. So I see sort of two sides of patients. One is the sicker patient, like I mentioned about the patient who has MS, a patient who has mold sensitivity. A lot of us are more sensitive to mold as we age. We notice it more because the estrogen depletes. Estrogen is this beautiful anti-inflammatory. So we'll see that sort of category of sicker patient that is more toxin sensitive. And then we'll see the other side of patients who are generally healthy. They just want to optimize their health. So for example, they have a great podcast that they want to continue doing, like Hot Flashes and Cool Topics, and they want to be able to do that really effectively. And they don't want to have anything like their health interfering with their ability to do that. So that's where we'll see either super healthy people that just want to optimize their health, or in people who do have some illness that need to recover from those illnesses.
Another thing that in the book was the talk about dementia. And you did say, look, if you're in dementia, that's not going to reverse that. But could you talk about how peptides can help your brain health?
Exactly. So just like the peptides will help your cells of your body, like your muscles, for example, to recover. One of the things that happens as we age that contributes to dementia and other neurodegenerative diseases is the inability to create and use energy efficiently. So your brain cells, the nerves in your brain, become inefficient at how they make and use energy. So if I can encourage those brain cells to be more efficient in how they do that, then they are better able to handle the stressors of life. So we are every day exposed to all kinds of toxins, the lead in the air from car exhaust, from gasoline, the mercury in our dental fillings, all of the things that we're exposed to every day, the plastics and everything. So if we can help ourselves to be able to efficiently remove those and cleanse ourselves from that, and then if we can help ourselves to be more efficient in how they use energy, then they are better able to function in day-to-day life. And so now a cell that may have been failing or struggling because it was inefficient now is better able to do things. So it's